Okay, give me a second. We're trying new technology here, so just want to make sure everything hooks up the way it's supposed to. Uh, hopefully this is going to work out well, just trying a different streaming platform. This is Dr. James Bogash, publisher of Modern Health Myths, and tonight we're going to talk a little bit about COVID-19 and convalescent plasma, and is this the answer of what we've been looking for, so for extremely severe people with COVID-19. So basically, convalescence is the title given to the gradual recovery of health and strength after an illness or an injury, generally referred to people who have survived infections, like say maybe COVID-19. This is not a new idea. This has been used since the late 1800s, long before we had antibiotics or vaccinations or anything else to treat a lot of today's infections, and used it for measles, MERS, the Middle East respiratory syndrome, CoV-1, so SARS, the first coronavirus that really created some problems, H1N1 influenza, both that included the 1918 pandemic and then the 2005 H1 influenza pandemic. Unfortunately, it's been tried for Ebola, but it was unsuccessful in managing Ebola. But there's not a whole lot of people that survive Ebola, so they probably have a little bit of sample to deal with. But generally best when used early. Everybody's kind of familiar with, you get bit by a rabid dog or hepatitis B exposure or tetanus, they'll use specific antibodies, not necessarily, or immunoglobulins, not from somebody who has had the disease, but engineered antibodies or immunoglobulins that are designed to swoop in and catch any of the virus that is present. And in these scenarios, it's the immunoglobulins that do the work. That kind of makes sense. If it's the immunoglobulins doing the work and they're designed to go in and scoop up these viruses, it's going to work better when it's used on the front end of an infection rather than the tail end. As I already mentioned, hepatitis B, rabies, tetanus, immunoglobulins generally do the work, but there's probably some other immune factors. Has to do with something called humoral antibodies, or the humoral immune system. There's probably other things like other proteins, like words that are escaping me right now, that help to drive the immune response. Complement proteins, one of the ones I was looking at. So there's probably some other things that can help not only the catch up, swoop up the viruses, but also engaging the patient's immune system to do a better play, or a better fight of the virus. Now, the research on this approach is not new. I already mentioned that it's been used for well over a century. For COVID-19, however, the first suggested use was in Lancet in February 27th. At the date of this video, 2 months after, or 2 months later. So most of this has all been centered around some finally peer-reviewed published study that was done on a small group of patients in Wuhan, and within 3 days, most of these, so it's, again, small group. Now it's been looked at and published in Proceedings of the National Academy of Sciences, which is a peer-reviewed journal. So this is the first time it's really gotten some good play based on other groups looking at the data. Within 3 days, most of the patients had improved clinical symptoms, higher blood oxygen levels in white blood cells, lowered CRP, a marker of inflammation, undetectable viral loads, and improved chest CTs. All very good signs. They found that they're generally most successful given within 14 days of symptom onset, so not as rapid as what we'd use with something with rabies or tetanus, but still early in the game. Actually, I consider 14 days kind of long. But even if it works within that, that means that we can choose to use it in the people who are looking like they're going south or have comorbidities that make them a much worse candidate for bad outcomes with this. The other nice thing to say is that there were no adverse effects with using the convalescent plasma. So that being said, before we get too excited about this, the reviews done on multiple studies for influenza didn't find that there was really a benefit. However, the safety of it was not in question. There were no safety issues associated with that. Now, that's not to say that there aren't some theoretical problems. Obviously, you can have a mismatch of blood type, even though generally they use plasma and the immunoglobulins. But just like with vaccination, there's a chance that you might theoretically elicit immune response where you're trying to protect the patient, actually sends it over into a cytokine storm that everybody's worried about. So those are theoretical. However, we're looking at a population who is at risk of very bad outcomes. So the risk benefit starts becoming a little bit more towards the potential for benefit. For me, I look at this as supporting human physiology rather than turning against it, which is what almost every medication on the planet does. So anything we can do that supports and works with the way the body is designed to work certainly makes sense. Didn't know that there's anything else on this topic that I just wanted to put that out, that the Proceedings National Academy of Sciences just came out this week. So I wanted to make sure that I shared that with you as soon as I could. Lots of movement in this direction. There are entities set up now to collect plasma from people who have survived and have positive antibodies to COVID-19. So it's definitely going to be an approach that we're going to see used probably quite heavily going forward, given that there hasn't been any signs of safety concerns, and that theoretically at least it has the potential to have a pretty big impact into people who might not have otherwise good outcomes. As always, I'll post the link to the backup, the supporting research in the comments, and make sure you like the video, share, and subscribe to the page. And I'll figure out how to stop the streaming.